Welcome to Grief and Loss Today. Hi, I'm Donna Brandenburg.
And I'm Andrea Harris.
Let's talk about the different therapies available for kids that are dealing with trauma and grief. You've done an extensive amount of research on it.
I have, because there's a lot available out there, and they have different things going for each of them. You know, we aren't just talking about death. We can be traumatized by different things. For example, I once was just driving along and somebody ran a stop sign and plowed into me. And I couldn't drive then for a while. I kept hearing the sound of that glass breaking in and feeling those feelings. The air whooshed in on me. It was terrifying. And I didn't want to get in a car again, but my job required it. So I went for a therapy called EMDR, which is eye movement desensitization and reprogramming. It's a mouthful, but boy, it works. One time, and it's a light bar that goes back and forth, and it accesses your memories and normalizes them so you can get over that anxiety. It just took one. Many take long. That would be the minimum. Children who have been terrified by something, and I'm not talking about just a little scare.
Mouse in the closet type thing.
Yes, terrified. They need some of these treatments called exposure treatments in order to heal from it. They shouldn't have to suffer from something like that. It could have been an accident for a child, but it also could be abuse, sexual abuse they may have had, or the death of someone, maybe watching grandma die and everybody's busy and not realizing that this little kid's taking it all in. They can be traumatized by many things. And so it helps to expose a child to it so that they can get what is called a sense of mastery over it.
Sense of control.
Yes. They got their hands around it and they don't have to be afraid anymore. Sometimes just having them draw pictures of it is enough. And anyone, mom can do that. Mom can help a child do this sort of thing. If it was a long-term and very serious trauma, it's going to take an expert to do it. It could be done by EMDR, but in our materials, we've listed the pros and cons of probably 5 different kinds of therapies that a child could, and said which is better for children, which is better for adults, and so forth, because we don't need to suffer as adults, and certainly our kids don't need to suffer with these traumas.
And giving people an ability to have a sense of control back in a very out-of-control. Grief and loss is generally an out-of-control circumstance that you can't affect. So if you can give people a sense of control back of, that's not scary anymore. That had one bad outcome, but it doesn't mean it's always going to have a bad outcome. And redirect it so that it's not always, a traumatizing, scary situation. Helps them to move forward.
It does, and I've talked to so many adults who have had something in their childhood and continue to suffer with it. They don't need to. Answers are out there.
Fantastic. Well, if you want to further explore this, we have an article called Effective Exposure Therapies for Children. We encourage you to explore our resources and let us help you grieve and help you to help others grieve.